This is Dr. Jerry Hesch. I'm a physical therapist and I work at a home office in Aurora, Colorado. And I run the Hesch Institute, which we treat chronic pain syndromes and treat joints throughout the whole body. And my website is www.heschinstitute.com. And I've published a book on the sacroiliac joint, 300 pages on Amazon, and done a book chapter on the sacroiliac joint, a chapter on sacral torsion, and have a current book chapter that will be published next year on treating the atlas. My client here, Shelby, tells me that she's a 29-year-old nurse who fell on ice getting off a ski lift, and that happened a year ago. Today is April 8th.
Yes.
And she fell in January of 2018. So she's been getting care for about a year now. And could you estimate the number of chiropractic visits and then the number of physical therapy visits you've had?
I've probably had 30 physical therapy visits and 12 chiropractic visits.
And basically you continue to have moderate to severe coccygeal pain?
Yes.
And you're aware of your pelvis being asymmetrical and your sacrum being less mobile on the left?
Yes.
Okay. And you report a leg length difference, and at first glance it looks like you do have one, and you had orthotics made when you were in college, and you had orthotics made about 3 years ago, but you don't really tolerate them.
Correct.
And they have a quarter-inch buildup on the left. So I'm curious to know, because I see what looks like a leg length difference, but she has a twist in her pelvis that might make a false appearance of a leg length difference. And so looking at the pelvis with her on her back, the right half of the pelvis, the ASIS, that's a little bony landmark on the front of the ilium, on the right is more forward towards the ceiling, and it's lower than the left. And the shelf of the ilium is lower on the right side. And when I take up the slack on the left and spring it, there is fairly normal mobility. Now, when I try and take up the slack on the right, I can't. It's stuck. This pelvis is stuck such that I cannot induce posterior rotation. Cleared the pubic joint. It has symmetry from the top of it and across the upper, middle, and lower third. And screened the hip joints, and they have full mobility. And let's have you lie on your stomach. And what we see with her prone is that the right shelf, iliac shelf, is higher than the left. And when I attempt to spring this inferiorly, there's no mobility. And when I attempt to spring on the left side, there's good spring mobility. I can see her heel bob up and down. And when I spring superiorly, there's good mobility. And when I spring superiorly through the right pelvis, there's good mobility. And when I palpate the sacrum, on the lower quadrant, I don't know if the camera can see that, but my left thumb on her left lower sacral quadrant is higher towards the ceiling by about 1/4 of an inch. It will overlap my right thumb when I walk across. And when I try and spring the sacrum, there's no mobility with a reasonable amount of force. And when I repeat that test on the right side, boom, there's movement. I can see her heels move, so the force goes through her sacroiliac joint, through the hip joint, down to the lower extremity. And when I spring it, there's additional mobility. And then when I palpate the coccyx, on each side, she has a deep, this left side is higher up, the sulcus is higher, and that is a left side bent coccyx. And how many times have you had internal mobilization for the coccyx?
Oh man, at 15?
At least 15 times.
Maybe 20.
Yeah,
20.
yeah. Some with an anterior approach, some with a
Yes.
posterior
Yes.
approach. And there was some controversy, like some felt that you had a right side bent coccyx.
Yes.
Is that correct?
Yes.
Okay. Now when the body orients to the left, and the sacral rotation orients the body to the left, the anterior ilium on the right orients the body to the left, and the left side bent coccyx orients to the left. So somewhere in the body, you have to counter-rotate to the right, okay? Let's have you lie on your back. And the easiest part of your body to counter-rotate is the first cervical vertebrae, also called the atlas. And the atlas has 45 degrees of right rotation and 45 degrees of left rotation. Now, what I'm going to do is palpate underneath the lamina and the transverse process of the first vertebrae, the atlas. So I isolate the occiput, and I come right beneath that on both sides, and I can go much deeper anteriorly on the left side than I can on the right. And when I lift up, you can see how freely I can rotate her head to the right. Okay? And now I'm going to pull on the right. Ready? 1, 2, 3, go, and there's nothing. It's very rigid. With a reasonable amount of force, with my finger, I can induce rotation of her head to the right. But when I lift up on the right side, there's no give. That joint is stuck. And that's a reflex. I will not have to treat this neck, because when we restore proper positioning and proper mobility of your right hemipelvis, your sacrum, and your coccyx, this will go away because it's driven by a reflex.
Okay.
Okay? Yeah. Maybe this will help reduce any neck pain or headache that you have. Mm-hmm. And believe it or not, sometimes we help migraine. And I know migraine is primarily a vascular phenomenon, mm-hmm. but your nervous system can be lit up a little bit when there's asymmetry of motion and asymmetry of position, and it can add to the whole body stress syndrome that may facilitate migraine. So in an indirect way, mm-hmm. my hope is that I help your migraine.
Great.
But no promises. Just to try. Just to do my best. So I believe that I can help you in a significant way in one visit, but I'll probably need 2 visits just to make sure we cover all bases.
Okay.
So my goals for you are to resolve your right anterior ilium, mm-hmm. and teach you how to keep it at bay,
okay.
doing something very, very simple a couple times a week.
Okay.
How to resolve your sacral torsion, mm-hmm. how to keep it at bay. I will reduce the coccygeal side bend, and that should stay away.
Okay.
And there's no need for you to do self-treatment. Okay. And then the upper cervical should melt away, okay. reflexively. No need to do anything for that as well.
Okay.
Okay?
Great.
So what I'm going to do is I think what I'll do is demonstrate how I treat this pattern.
Okay.
Which is pretty straightforward, and it's common sense. Okay? So what I'm going to have you do is hug your right knee outside of your shoulder. Okay? Good. So the knee is towards the chest and then moved outward to the outside of your right shoulder. And you're going to do that for 2 minutes.
Okay. And
that should correct the anterior ilium.
Okay.
Okay? Now, go ahead and keep doing that for 2 minutes, and I'll demonstrate on myself what the self-correction for a sacral torsion is. And what you do is you take a 2-inch height, 2-inch by 4-inch by 8-inch foam. I really like this foam because it indents a little bit. It's a foam that we sell, and you indent a little bit and then it becomes firm, so it melds to the shape of your body. And what you do is you put it across the middle of your pelvis, right above the bony, right above the midline crease where you find the tailbone, right above that tailbone. You lean against the wall. The flat part of foam is against the wall. Feet are as wide as your shoulders, and your heel is about 4 inches forward. Just a comfortable stance. Yeah. And what you do is you keep pressure against the foam, and you bend forward. Don't look down, just look straight ahead, and you touch your shoulder blades to the wall, and you bend forward. Far enough that your nose is in front of your toes. And you do that 10 times. And that will straighten out your sacrum. It'll straighten out the rotation, it'll straighten out the side bending, and it'll balance the facet joints at L5S1. This is a very, very good preventive exercise. So since you are a nurse, mm-hmm. and you work in a busy emergency room pushing beds and pushing patients and all that stuff, I want you to do this every single day.
Okay. Yep.
especially on work days.
Okay. How many times?
10 times.
10 times.
10 times,
Okay.
once a day.
Okay.
Yeah. And then I'll show you the technique that I use for treating the coccyx, and I'll demonstrate on a pelvic model.
Okay.
This is a bony model. You can put your foot down now.
Okay.
This is a bony model, and the coccyx is bent over to the left in her presentation. So this sulc is hitting the transverse process of the first coccygeal segment, is deeper, higher up, as compared to the right side. And the technique that I developed and use, and it's common sense, is to have her lay on her stomach, put pillows under her ankles so she's relaxed. And I capture these ligaments. Underneath here is the sacrospinous ligament that you can't see, and it fans out and attaches coccyx and sacrum. And then this is sacrotuberous ligament, and then sacrococcygeal ligaments. And I capture all of them on the right side. And I push to the right for 5 minutes. And then I come to the outside of the coccyx and I push directly on the coccyx to the right for 5 minutes. And it might be the case that less is adequate. Maybe 3 minutes is adequate. But I use a very, very small force, and my goal is to make a very lasting response to that.
Okay.
So I'll stop filming now, and I'll treat you, and then we'll film your response to treatment.